Evening, a very good evening. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. Yes, I hope I'm audible and visible, everyone. Okay, that's great. So here we are to discuss this topic in like next 15 to 20 minutes, the topic of the cranial nerve functional columns. Many of you had asked for this topic on the Telegram group, and in the daily targets also that we are following, we have anatomy going on. So to help you in achieving those daily targets, here I am to help you in this topic of cranial nerve functional columns, right? Before we proceed with the session, I'm not sure how many of you know about it, but for those who don't know, so I've started with the NEET PG Extra Edge batch today itself. 12 p.m. we have the sessions. Even there we took anatomy, mnemonics, where we discussed the perineal pouches. We simplified the anatomy. We learned the tricks of remembering that. We discussed we discussed few other topics in anatomy that are very, very important. So all those who are the plus subscribers or the iconic subscribers on an academy, make sure you are attending these classes where we have one day, one subject, and we are learning the tricks of the important topics in those respective subjects. I'll be doing the mnemonics of all the subjects, the KBMDs, that is the clinical case, system-wise integrated MCQs, and then we would be having the PYQs and the related topics as well. Right. So if you're planning to subscribe to an academy, you can use my code Dr. Nikita to get additional discount while you're subscribing. And we also have the ongoing Unlock 20 offer on the platform, where instead of 10%, you get 20% off, and already 15% prices we have slashed. So you get significant off. So for example, let's say that the regular price of 6 months is 22,500, and now if you buy it where you have unlocked 20, you'll get it for 15,300, right? All you need to do is use the code Dr. Nikita, right? And you can use it for iconic subscription as well. Okay, that was great class. Thank you so much, Muskan. KBMD, we will be having few KBMDs in the special classes, the free live classes as well. And we'll be having the more structured KBMDs, the MCQ discussion on the Plus platform as well. Right, so the Plus subscribers who have subscribed should get something extra, right? So we have additional KBMDs for them as well. Okay, and apart from that, the free live classes, the YouTube sessions will go on, but everything cannot be covered there. So we have it on the Plus platform as well. Okay, let's try answering this question, the pre-session assessment, and let me also tell you that we have one more session today at 9 p.m. which is going to be on an academy app, and it's a free live class. It's a special class where we are going to learn the tricks of the types of joints, right? A very confusing topic, but a very, very important topic, be it for AIIMS, NEET PG, FMGE, how to remember which is plain joint, which is saddle joint, ball and socket, all of those we are going to discuss in the 9 p.m. free live class. Okay, all right. So all of the following cranial nerves contain somatic efferent except which of the following? What do you think is the answer to this? Let's see this. Yes. Thank you so much, Dr. Grace, for that compliment. What do you think is the answer to this? Absolutely right, Swati, correct. The answer is C, that is 7th. We'll come to that why it is C. Okay, we'll come to that why it is C. Okay, so before we go ahead, look at the various columns that we have: general somatic efferent, special visceral efferent, general visceral afferent. Then we have GVA, SVA, GSA and SSA. The one that we do not have is basically we don't have special somatic efferent. Okay, we don't have special somatic efferent. So a few points that I want you to understand. This seems like a confusing topic, but in the next 15 minutes or so, I'll try to simplify it for you. So basically the terminologies that we have, it's a somatic column, or it's a visceral column, it's a afferent column, or it's a efferent column, and it's a general or it's a special, right? So basically the permutations and combinations here give us the various columns, okay? Now, as we understand by the terms, a efferent column will be one which will be basically a motor cranial nerve, right? Supplying the muscles. It's going to be the motor nerve. Afferent basically means sensory, right? It's carrying the sensation. It is sensory. So even in sensory, we will have general sensory and we will have special sensory, right? Now, what do we mean by special sensory? So the nerves which are carrying the special sensations like the hearing, okay, like the taste, olfaction, all of these are basically going to be the special sensory wale columns. Now, even in the special sensory, which is special somatic afferent and which is special visceral afferent, right? You have the special afferent. Special afferent tells you that it is special sensation that is being carried, like the taste and hearing. So which is out of that, which is somatic and which is visceral. The trick to remember here is which sensory organ, the special sensory organ is the one which is within the body. Basically, it is not seen from outside. You don't see it from outside. Ears, you can see from outside. Nose, you can see from outside. Eyes, you can see from outside. It is the tongue which is inside. You cannot see it as a samne se, bahar se, right? So remember, visceral matlab inside. So basically the taste sensation is the special visceral afferent. Hearing and the rest of them is basically going to come under special somatic afferent. So hearing, that is your vestibulocochlear nerve, the 8th nerve will come under special somatic afferent. Taste sensation, what will be the nucleus and the cranial nerves for special visceral afferent? So taste sensation is basically the taste from the tongue we had seen in one of the recent anatomy mnemonics class. It is carried by nucleus tractus solitarius, that is N for 9, T for 10, S for 7. Okay, these are the cranial nerves in nucleus tractus solitarius. So basically special visceral afferent will be NTS and the nerves would be 7, 9, 10. Okay, these are the nerves that carry the sensation. Anterior 2/3, posterior 1/3 and the posterior most, right? That is what we have there. Just give me a minute. Yes, here I am back. All right. So I got up because Kyra is sleeping here and I had switched off the fan and she's doing all the hildul and I do not want her to wake up. Okay. So you might hear some fan car sound now in the background, but I hope that's fine. All right. So taste, that is special visceral afferent, that is nucleus tractus solitarius. Okay. So this was about this part. Now going to the rest of the columns. Okay, talking about the rest of the columns here. What do we mean by general somatic efferent? Okay, what do we mean by general somatic efferent? So first of all, it is efferent. That means it is going to be the motor nerves. Okay, and we have general somatic. So again remember somatic यानी ये जो बाहर के muscles हैं, the eye muscles, the extraocular muscles and the tongue muscles. The nerves supplying the extraocular muscles and the tongue muscles will basically come under general somatic efferent. So what supplies the extraocular muscles? What supplies the extraocular muscles? So basically it is cranial nerves 3, 4, 6. And what supplies the tongue muscles predominantly? It is cranial nerve 12 except palatoglossus. Okay? So 3, 4, 6, 12 will be basically, it will be basically your general somatic efferent. What is general visceral efferent? What is general visceral efferent? Just remember these terms. Okay, that will help you to remember the columns. General visceral efferent, that means to the viscera. Efferent, viscera we know basically autonomic nervous system. So remember it is parasympathetic nerves. Which are the parasympathetic nerves? Basically 3, 7, 9, 10. Okay, the parasympathetic nerves are 3, 7, 9, 10. So these will come under general visceral efferent. Okay, these will come under general visceral efferent. We will see which nucleus of these basically, we will see those as well. The next one, what do we mean by special visceral efferent? Okay, what do we mean by special visceral efferent? Special visceral efferent basically are the nerves which are branchial arch wale nerves. Okay, which are branchial arch wale. So which are the branchial arch? One ka nerve is 5. Then we have the odd numbers basically 5, 7, 9 and we have 10. Okay, so basically 5, 7, 9, 10 we have as the special visceral efferent, and even 11 because basically the nucleus of the 10th nerve that we have here is nucleus ambiguous. Okay, that is nucleus ambiguous which has 9, 10, 11 cranial nerves. Okay, which has 9, 10, 11 cranial nerves. So I hope you have understood these terminologies. General somatic efferent, muscles ko jaane wala, eye and the tongue muscles. Visceral efferent is the parasympathetic 3, 7, 9, 10. Special visceral efferent is the branchial arch wala, which is 5, 7, 9, 10 and 11 as a component of nucleus ambiguous. Okay? We don't have special somatic efferent here. Okay, we don't have special somatic efferent. Okay, we have general somatic efferent, general visceral efferent, special visceral efferent. In the afferent, what do we have basically in the afferent? So those we talk about the efferent. What do we have in the afferent? We have general somatic afferent, we have special somatic afferent, general visceral afferent and special visceral afferent. So basically the special afferent are the ones which are the special senses, right? So basically the special senses. We said that the special somatic afferent is the one which is outside, like the hearing, the cranial nerve 8. Visceral special visceral afferent is the taste wala, which is nucleus tractus solitarius 9, 10, 7. What is general somatic afferent? So basically carrying the general sensation, that is the pain, touch, temperature from the face. We all know that it is a trigeminal nerve. Okay, it is the trigeminal nerve which carries the general sensation. Okay, so it's gonna be the trigeminal nerve. Thinking logically, if you have a question which asks that, which of the following nucleus of trigeminal nerve is not included in the GSA column? Options are spinal, sensory, motor, mesencephalic. What do you think would be the answer to that? Which of the following nucleus of trigeminal nerve is not included in the GSA column, the general somatic afferent column? Spinal, sensory, mesencephalic, motor. Which of these will not be included? Right, it's going to be the motor which is not included, because motor basically, as the term says, motor means efferent. Okay, motor means efferent. It is supplying the muscles. Which efferent column does this belong to? The fifth nerve. Which efferent column? Is it the general somatic efferent? Is it the general visceral efferent? Or is it the special visceral efferent? Right, Dr. Grace saying logically motor is efferent, it's not afferent. So which efferent column it belongs to? We have already discussed. It is special visceral efferent. The fifth nerve is the nerve of the first branchial arch. So it is special visceral efferent, right? The rest of the three would be GSA, spinal, sensory, mesencephalic. Out of that, which carries the proprioception? Proprioception is basically carried by the mesencephalic nucleus. Okay, the mesencephalic nucleus. Okay? Special somatic हो गया, special visceral हो गया, general visceral afferent is the same, that is nucleus tractus solitarius. Okay, remember that is NTS, the general visceral afferent. From the viscera, basically it is the NTS. Okay, now let's go back to this table. I hope you are able to see this. So what did we learn? GSE, general somatic efferent, the muscles of the eye and the tongue. So 3, 4, 6 and 12. Okay. Special visceral efferent is basically the branchial arch, the pharyngeal apparatus. You have the fifth motor nucleus efferent. Then you have the facial nerve ka motor nucleus. And we have nucleus ambiguous, that is 9, 10, 11. Right? We said 5, 7, 9, 10, 11. Ambiguous is the motor nucleus of vagus. General visceral efferent, we said it is parasympathetic. 3, 7, 9, 10. Right, which nucleus of the third nerve? 3 को जब आप उल्टा लिखोगे, that will be E, Edinger-Westphal nucleus. For 7, S for S, it is superior salivatory nucleus. For 9IN, it is inferior salivatory nucleus. And you have the dorsal nucleus of vagus. Please remember, here it is in the general visceral efferent, it is the dorsal nucleus. Okay, it's not the nucleus ambiguous or the motor nucleus. Basically, it's the dorsal nucleus. GVA, SVA, basically all the visceral afferent, it is NTS. Okay, it is WANTS. VA, visceral afferent, is basically NTS. Nucleus tractus solitarius, 9, 10, 7. GSA, the general sensation, is the sensory nuclei of the fifth nerve. Chief sensory, mesencephalic and spinal. Okay, motor is not included, the rest are included. Special somatic is your vestibulocochlear, the hearing wala. Okay, so it is as easy as that. The cranial functional nerve columns, we have done this. Let's have a look at the detailed column. So the first one, that is olfactory nerve, basically carries smell, so it comes under special sensation, special somatic afferent. Second, again it carries vision, sight, special sensation, special somatic afferent. Okay. Third cranial nerve. What all are the nucleus in the third cranial nerve? One, it supplies the extraocular muscles. So general somatic efferent. Okay, so extrinsic muscles. And you have the general visceral efferent, which is Edinger-Westphal nucleus. Fourth, supplies the trochlear. Right, so it is general somatic efferent. Fifth is special visceral efferent, the branchial arch, that is the first one, supplying the muscles of mastication, and the general somatic afferent, which basically carries the sensation. Proprioception is by the mesencephalic nucleus. Abducent, sixth, 3, 4, 6 is general somatic efferent, eye wala. Then you have the seventh nerve. Seventh nerve, 3, 7, 9, 10 comes under parasympathetic GVE. 5, 7, 9, 10, 11 comes under special visceral efferent, right? And it also is a component of 7, 9, 10, that is the NTS. So it is special visceral afferent as well, right? Some books also mention the seventh nerve under GSA, the spinal nucleus of fifth nerve. Basically, it carries some sensation from the external ear. Okay, so seventh also is included in GSA. Eighth nerve, hearing. So it is special somatic afferent. Okay? Ninth nerve, 3, 7, 9, 10, 5, 7, 9, 10, 11. So it is branchial arch SVE, parasympathetic GVE and the NTS, 9, 10, 7, GVA, SVA, right? 10th nerve, similarly, again here, it is SVE, branchial arch, GVE, parasympathetic, NTS, GVA, SVA, right? And the 10th nerve also carries some sensation from external ear. Maybe you can skip this if you want. 11th, as a component of nucleus ambiguous, is SVE, the branchial arch, nucleus ambiguous, right? And some books included in GSE, basically the muscles, the trapezius and the sternocleidomastoid. So muscles are supplied, causing the movement of head and shoulder. So it's included in GSE. 12th nerve is the tongue muscles. So it is general somatic afferent. Okay. Thomas Shelby, so olfaction comes under special somatic afferent, SSA. Under SVA, we have taste. Remember, it is tongue is the only one which is inside. Nose you can see, eyes you can see, ears you can see. So all this is special somatic afferent. Tongue is basically special visceral afferent. Right, NTS has both. So that is where we had written wants. Visceral afferent, be it general, be it special, it is NTS, 9, 10, 7. Okay, it is 9, 10, 7. Okay? So let's quickly try solving some questions on these, the MCQs. All of the following pairs regarding the neural columns and associated nuclei are correct, except, tell me, what do you think is the answer to this? What do you think is the answer to this? So GSC is basically general somatic efferent, the eye and the tongue. SVE is the branchial arch. GVA is basically the NTS, and SVA is basically NTS. Correct. It is the C which is the answer. The dorsal nucleus of vagus comes under which column? It is general visceral efferent, the parasympathetic wala, right? The general visceral efferent, parasympathetic wala. Okay? Next one. All of the following cranial nerves contain somatic efferent. This is where we had seen the first question. Somatic efferent is only general somatic efferent. We don't have special somatic efferent. Except, so 3, 4, 6, 12. So 7 is not there. Okay, 7 is not there in the somatic efferent. Next one. Nucleus tractus solitarius receives fibers from all of the following cranial nerves except NTS. It is 9, 10, 7. N for 9, T for 10, S for 7. So 9, 10, 7. 9 is there, 7 is there, 10 is there. 11 is not there. Okay, 11 is not there. All of the following nerves have general visceral fibers except, again, general visceral, olfactory, oculomotor, facial, glossopharyngeal. So 3, 7, 9. So let's consider it as general visceral efferent. That is the parasympathetic wala. 3, 7, 9, 10. Olfactory is not there. Olfactory is the special sensation. We know that it's gonna be special somatic afferent. Okay, it is going to be special somatic afferent. Okay? So yes, that was about the today's topic, the cranial nerve functional columns. You just need to remember the simple concepts: afferent, efferent, general, special, and somatic and visceral. Right? If you decode the terms, then it becomes easy. Just remember those terminologies which we said. GSC is eye, tongue, and maybe the trapezius and sternocleidomastoid. GVE is parasympathetic. SVE is branchial arch. Then we have GSA, which is the general sensation, general afferent, trigeminal. Then we have special somatic afferent, which is Baharwale special senses. General visceral afferent, NTS. Special visceral afferent is also NTS, right? Visceral afferent is basically NTS. SVA basically is the taste sensation. Okay? So it was as easy as that. So the cranial nerve functional columns, quick reminder, we will be having the next class in this batch for the plus subscribers on Unacademy on 14th, 12 p.m. where the next subject that we are going to do is biochemistry. Okay, so please let me know, all those who are the plus subscribers, what topics in biochemistry do you want me to cover on priority. Right, so I'll work on those. Okay, I'll share the PDF on the Telegram group after this session is over. Okay, thank you so much everyone for joining in for this quick session and quick mnemonics in this topic of cranial nerve functional columns. I hope you have enjoyed it and you have learned the tricks of this topic. So goodbye, take care, and keep studying, keep revising, and keep winning. And remember, we are meeting again at 9 p.m. like I mentioned on the Unacademy app for a free class to discuss the mnemonics in the types of joints, right? We'll simplify the topic of types of joints tonight 9 p.m. I'll be sharing the link on the Telegram group. Okay, goodbye everyone and take care.